Behcets disease by
Katlyne
and Chabod. These are some of the outcomes we will be learning about associated with Behcets disease. Immune function. Here we will be comparing about how a normal immune system functions versus how Behcets disease affects it. In a normal immune function, after a pathogen has been killed, inflammation helps resolve the issue. It can identify and kill harmful pathogens as well as deter from self and foreign objects. It also protects tissue from becoming damaged. While Behcets disease, what it does is attacks healthy blood vessels, causes chronic inflammation, immune system cannot distinguish healthy from unhealthy tissue, and can lead to joint pain, vision issues, organ damage, and ulcers.
Classification of Behcets. So Behcets disease is classified as an autoimmune vasculitis, which means that the immune system mistakenly attacks healthy blood vessels and treating them as they are harmful. Both arteries and veins of all sizes are damaged throughout the body because it is not able to differentiate between the two, if they are healthy or unhealthy. And a lot of these factors a lot of the contributions could be environmental and genetic factors, which we'll be touching on later.
Etiology. Exact cause of Behcets is unknown, but some factors that can contribute is genotype, one's genetic makeup, which is the presence of the specific gene HLA-B51, which is associated with the development of Behcets, drug reactions, smoking, autoimmune diseases, hepatitis B and C infections, immune system diseases, specifically ones destroying blood vessels by mistake, such as infection, blood cancers, rheumatoid arthritis, and lupus.
Signs and symptoms. An early sign of Behcets disease is the appearance of mouth sores, which this is the first major symptom. Mouth sores, as well as other sores that can develop on your face, neck, and most commonly your genital area. The second major symptom is your eyes are affected, which can include vision problems, sensitivity to light, swelling of the eyes, and eye redness. And some other signs and symptoms can be painful and swollen joints, digestive problems, inflammation in the brain, which can cause headaches, fatigue, and skin lesions.
Extreme symptoms. Lung involvement is a less common but serious symptom of Behcets disease. It presents with cough, dyspnea, shortness of breath, and sometimes pulmonary artery aneurysms. An aneurysm is a localized enlargement of artery caused by the weakening of the artery's wall. Aneurysms of the wall of the lung can rupture and cause lung hemorrhaging.
Diagnostic testing. Currently, there is no single test that can definitively diagnose Behcets disease. Instead, healthcare providers must rely on identifying patterns of signs and symptoms to make a diagnosis. And to confirm this, at least 3 specific symptoms must be present. There are tests available to rule out other potential causes of symptoms, along with help detect indicators of the condition.
These are some of the tests that can be ordered to help rule out other conditions to diagnose Behcets: X-ray, pathogy test, blood test, urine test, skin biopsy, and CT/MRI.
Treatments. There is no cure for Behcets disease, and it will affect you throughout your life. However, medications are available to manage flare-ups and control symptoms, along with systemic treatments that work to address the condition from within. So we have 2 different treatment options: individual treatment for symptoms, which is applied directly to the source or any external symptoms, and I said before, systemic treatments, they help treat signs and symptoms internally. There are 3 different ways of individual treatments: skin creams, gels and ointments, mouth rinses, and eye drops. These are all helped to reduce pain, inflammation, and redness on the outside. For our systemic treatment, we have corticosteroids, which are the most common is prednisone, and they help reduce inflammation. We have NSAIDs, they help and relieve inflammation as well as help treat joint pain. We have immunosuppressants, They help reduce the activity of the immune system. And then we have biological therapies, which are newer drugs that systemic therapies that target specific biological proteins that promote disease activity and cause symptoms.
Treatment and side effects. Medication including infliximab and adalimumab may have side effects such as headaches, skin rashes, and potentially put patients at an increased risk of infection. 2. Corticosteroids are effective when managing Behcets disease, but can also cause side effects such as weight gain, persistent heartburn, high blood pressure, as well as bone thinning, called osteoporosis. 3. The constant use of cyclosporin and cyclophosphamide can put you at an increased risk of infection, liver and kidney disease, low blood count, infertility, and high blood pressure.
Complications. It is important to keep on top of your treatment plan, not only to manage the signs and symptoms of Behcets disease, but as well to avoid complications. There are 3 major complications that can happen throughout the body, with your vision, your neurological function, and your vascular. So with vision, untreated inflammation can potentially cause damage to one's eyesight and all of the other symptoms we described. Vascular, inflammation to the arteries and veins can cause blood clots, which reduces blood flow to vital organs and systems. Or neurological, inflammation can affect any part of the central nervous system, but it is most often causes a type of brain and spinal cord inflammation called subacute meningoencephalitis, usually in the brain stem or the diencephalon. Inflammation can also occur in other areas of the brain and spinal cord, and in some cases, large swelling lesions may form in the diencephalon. This condition can lead to problems with thinking and mood, including psychosis, along with increased anxiety and fatigue. These symptoms are typically worse in the people with more severe neurological involvement.
These are our references. Thank you.